I'm Dr. Mark Blatt, Intel's Worldwide Medical Director. We're here today to talk about an exciting new solution in home care, remote monitoring, a solution that will help improve the quality of health care and keep people out of the hospital. Today I have two distinguished guests with me. I have Dr. Raj Bhatt from Dignity Health and Naveen Govind, the CEO of Aventine Health. Guys, thank you very much for coming in, and thank you very much for being here with me.
Thank you.
Want to talk a little bit about the Aventine solution. So maybe you could describe it very briefly, Dr. Bhatt, what that solution means to you.
So the solution is called VitalBeat, and it's basically a remote monitoring system consistent with mobile health technology, basically sending vitals signs or other clinical data back to the clinician so they can make appropriate decisions regarding their care and the ultimate goal of preventing readmissions to the hospital and improving their health overall.
So the ability to care for people outside the hospital with streaming telemetry, you said imaging media as well as sensor data all coming to you on one platform.
Correct.
That's fantastic. What can you do with that data and information? Where will it be useful for you?
So basically, these type of data will be pushed seamlessly into an electronic medical record system, and then we could use that information to try to prevent readmissions to the hospital and improving their care of the patient, and or avoiding unnecessary medicines or costs as well.
That sounds like, given the climate with the ACO developments and increased shared savings, this would be a perfect answer?
Perfect answer for that, and a perfect solution for that.
But you are describing a really different workflow than what you're used to as a doctor. I mean, we got trained to be in there face-to-face with patients. This is all remote. What do you think about that as a doc?
I think this is the wave of the future. I think the physicians are still going to be doing what they've always done, but this is another addition to that, and the information coming remotely from the patient's home or wherever they are located, and the vital signs, the other clinical information, which we'll talk about, that can be then acted upon by the physician, and therefore basically improve their care.
So a platform approach that brings in the telemetry remotely, the streaming data remotely, imaging data, drops it into the EMR and allows the clinician to make a remote decision.
Correct.
Pretty cool.
Yes.
Naveen, could you describe a little bit more about the technology that's involved in getting this solution up?
Sure, Dr. Blatt. So the entire platform was originally built as a turnkey type of a solution. What today we enable is to manage different types of disease condition in one integrated sort of an environment. So we do that using cloud-based type of technologies where the clinician can access the different types of patient information, as Dr. Bhatt was talking about, in terms of personalized type of medicine. To that extent, we have different types of monitoring devices, such as the patient-worn device that I have on my wrist here, which is the VisiMobile. Anything from 3-lead to 5-lead type ECG, pulse ox type of data can be pushed, not just from a patient's bedside, but if they're at home or in an ambulatory type of setting.
You have a couple of other sensors I see here?
Yeah, I do. This is what we refer to, I guess Dr. Bhatt was...
It's like a boomerang.
Yeah,
yes.
Boomerang, and kind of like Iron Man. Yeah. So this is a very exciting device. It's the Nova Perminova necklace. Basically, what this can enable is very similar to what typically would be in a clinic that a heart failure patient would be using to capture ICG or impedance cardiography type of monitoring. So the patient can now wear this at home, and we can capture cardiac output, stroke volume, stroke index type of parameters, which is very exciting. I think this is something that is now mobile enabled, and we're really
and that
looking
feeds
forward
into
to
your platform approach.
Yes, yes. So we're looking to feed this not just into the EMR, but also make this available in terms of trending a patient's information in a longitudinal manner.
So now I have an advanced sensor, which I used to have to stick needles in people to get cardiac output, stroke volume.
Absolutely.
What can you do with this as a clinician?
This is fantastic. So basically, without doing any kind of invasive procedure, we can get this data, such as cardiac output, through the cloud-based system into the EMR, and then we can tell, Mr. Smith, you have your cardiac output has gone down. I'm worried about you. I think you may go into congestive heart failure pretty quickly here, so let's give you some medicines to try to prevent that. So even before they get short of breath or start to get extra fluid, this cardiac output information is, I believe, crucial. Going forward here.
It's almost like the psychic doctor.
Yeah.
We'll treat you 10 minutes before you get sick. What a great idea. Guys, I'm noticing these tablets here. So is this the way you prefer as a clinician to get the information on a device like this?
Yes, I think each physician is has their own preferences, but for the most part, I would say that they would prefer the tablet or the desktop, or in emergencies even the handheld device. And these devices are great. They have long battery life, and it's password protected, encrypted, HIPAA compliant, and cloud-based, and they're portable. They're easy to read and to use, and it works for me.
Lightweight, the right size,
yes.
Big enough.
Yeah.
Naveen, you had said you had done some work with this device, and you had some interesting comments about the battery life.
Yeah, yes, Dr. Black. So we have two devices there. There's Atom. They're both Atom-based. One's running Windows 8, and then the other is an Android-based tablet. And the Android-based version, running our VitalBeat application software, we've experienced 3 days of battery life without having to recharge it, which is incredible. And I think that it's been a very valuable feature that obviously not just our users, but from a technology perspective, really helps not having to recharge it.
So now as a clinician, lightweight, it's almost like you're carrying all the information from the patient like you had in the ICU, now around on a tablet, and it doesn't matter where the patient is.
Or where you are, too, either. So that's perfect.
I noticed both of these devices have cameras built into them, so you can actually view yourself and view the patient. So can you see a value for the camera and how that might fit into this?
Oh, absolutely. So on the left-hand side of the screen, you could be getting the patient's vitals or the other clinical data, and then on the right-hand side of the screen, you can Google Talk your patient and say, Mr. Smith, your blood pressure is too high, and here you need to adjust some medicines. This is how we're going to do it. And I think that's the wave of the future going forward here.
This is a tremendous change in workflow. Remote monitoring, remote video interaction, real-time vital signs, streaming data, multiple sensors off a platform which will pull in just about anything, including, my God, cardiac output. I'm impressed. It really sounds like the future has arrived, and the future is Aventine. Wow. Should be proud, guys.
Thank you.
Very exciting solution. Well, I want to thank you very much for joining us here today. Come to the Intel website to hear more about the Aventine solution and to come hear more about what Intel is doing in healthcare. Thank you very much.